Some other details, it's $82 billion split into $27 billion in direct funding and $55 billion in taxes and deferrals and similar measures. And that includes 2 new benefits for workers whose jobs are affected by the coronavirus pandemic, expanded employment insurance benefits, and increased payments through the Canada Child Benefit. The hope is that this will be money going directly into the pockets of Canadians. Let's go to Mike Lecouture, who has been listening and watching all of this. Mike, what more can you tell us about this emergency aid package?
Yeah, so for right now, it's in the Senate. They started at 10 a.m. with an emergency session. First 2 readings that have to go through it. I'm not going to bore too many people with what the Senate will have to go through here, but they will have to go through 2 readings of the bill, and then it's something called Committee of the Whole, and that's what's happening right now. You see Bill Morneau, the finance minister there. Committee of the Whole basically means that all of the senators who are there, and there's just over 20, will be questioning him and asking him about this bill, and having the normal checks and balances that you see in any kind of committee and what the Senate wants to be, the chamber of sober second thought. And he was grilled specifically on the EI benefits. There's a lot of questions on why we are not also boosting the wage supplements. It was brought up by the Conservative Senate leader, Don Plett, saying, why isn't it more like the UK or Denmark? But in response, you'll hear here that Bill Morneau is saying that they do believe that this is the best method to get money out the door as quickly as possible. Have a listen.
So it's a simple and effective way for us to get money to people. We are working hard to make sure that that happens rapidly. We expect that the week of April 6th is our target date.
So you see there, they're hoping that it can get out the door as soon as possible, looking at other measures that could be as soon as May, and some of those child benefit checks going out the door as well, just to give people a lay of the land. After this happens, then they'll have a vote. And then what we're expecting is that there will be the 3rd reading. They wait for royal assent, so that's the message from the Governor General to say that everything's good to go. While they wait for that, they will also have a 2nd Committee of the Whole, which will be asking the Ministers of Health and Public Safety, so Patty Hajdu and Bill Blair. This bill isn't related to them, but the senators want them before the chamber so they can ask them about what the overall plan is. 1, with the border, and 2, for the public health side of it. They want to make sure that going forward, that what is going to be taking place. How are we going to be taking care of Canadians, protecting Canadians? And remarkably enough, one Senate source told me that despite the fact that they're going to have those 2 ministers there for about 90 minutes or so, they're going to get this wrapped up by about 2 or 3 o'clock today. Kind of different from what we saw from the House of Commons, Donna, which obviously went into the wee hours of the night. But there's approximately 26 senators there representing all of the groups, the Independent Senators Group, the Conservative Senators Group, the Canadian Senators Group, which is another one of those independents, and a non-affiliated senator. So they expect this to get through by, like I said, day's end at the latest.
Well, I guess we're not expecting huge delays in the Senate, but can you talk a bit, Mike, about what happened yesterday in Parliament? Originally, we were told this emergency spending bill was going to get through with unanimous consent. Everybody agreed to it, and then turns out there were some measures in the draft bill, at least, that took a lot of people by surprise, and giving sweeping powers to the finance minister to tax and spend until the end of 2021 without any parliamentary oversight. Assuming, I guess, that Parliament could never reconvene and therefore it was necessary for the government to have these extraordinary powers. That's been reeled in, though, right? Morneau has some special powers now, but not as much as was originally proposed in that draft bill.
Yeah, and of course there's negotiations that were going out throughout the night. We're hearing from different sources as to how those went. One source told me that as soon as the Bloc Québécois got their assurances that the aerospace industry would be taken care of, that they basically walked away and said, okay, this is good enough for us. We don't need unanimous consent in the House, which is what actually was proposed originally, that everybody in the House had to agree with this bill going forward. But the Bloc Québécois was ready to just let that go for a House vote. And the numbers in the House show that if you have the members of the Bloc Québécois and the members of the Liberal benches vote together, something will go through, anything will go through. This package would have gone through. And so essentially, you had the two other parties, the NDP and the Conservatives, kind of looked at the Bloc and said, I thought we were all in this together, guys. But anyways, they continued to negotiate into the wee hours of the night to hammer out these, to put, not to put the government in a box, but at least to have some sort of oversight. So what we're also hearing is that the Health Committee and Finance Committee can now meet via teleconference. We know that there are limitations put on travel, and there could be even more limitations put on travel. These MPs don't want to be going on planes and coming to Ottawa every time they have to meet. So that will now be baked into this legislation to ensure that if there is some sort of oversight that is needed to check some of this legislation or to check something that the finance minister or health minister feels like they need to do, that this committee can quickly come together via teleconference, have discussions, talk to the ministers, and make sure that these checks and balances are in there. I mean, our system is based around an opposition making sure and keeping an eye on what this government is doing. And the opposition, it's not job justification, but they're trying to make sure that they don't just hand a blank check or all the power in the country to this government to do as they see fit. And I think it's a bit of once bitten, twice shy. You saw when the House first broke a few weeks ago, there was a lot of goodwill. You had Mark Strahl, who was the whip or the House leader of the Conservatives, say, look, we think that this government will do a good enough job. This is as many powers as we feel will be good enough. And then, we can get back here on April 20th and then all talk about this, but we're ready to come back at any point. And I think they feel like that goodwill was a little bit eroded when you saw what came out, especially as you mentioned, Donna, spending powers for this finance minister until December 21st. And I think the government was looking at it in a sense of, we need to make sure that we can pivot. The Prime Minister said it yesterday. We need to react quickly and respond quickly. But at the same time, this opposition said, look, we're with you here, but we're not just going to hand you everything just so that you can do this until as long as you want. I think everybody is looking at this and saying, look, if we can aim for September, the hope is, everybody's fingers crossed, that we'll be through all of this. And then if not, we can re-examine it then. But at the same time, having those committees, and that was part of that negotiation, having those committees to meet via teleconference to be able to say, okay, we can still have an eye on what's going on in Parliament. And it seems like finally, in the wee hours of the night, everybody agreed to it. The bleary-eyed MPs who had unanimous consent on it, and now going through the Senate, and as we said, Donna, expecting that will receive royal assent later on today.
All right, Mike LeCouture, thanks. Let's go to Mercedes Stephenson. Mercedes, you're working from home like so many people. Interesting to hear that, the committees at least are going to try to teleconference now, and the committees of the House of Commons to try and get things done. Oh, apologies, we don't have Mercedes Stephenson. I'm sorry, we're all working at a distance here, and I was told Mercedes was ready to do this. Mercedes Stephenson, our Ottawa bureau chief, of course, broke the story about this contentious part of the draft bill that was giving the government's unanimous powers until the end of 2021. That part of the contentious bill has been withdrawn. So I want to remind you why we're here. We're waiting for the Prime Minister to speak. He's going to emerge from his home, Rideau Cottage, shortly. We're hoping in the next 5 minutes or so to bring us more of the details of what's in that bill, what Canadians can expect from the government to support them. The Finance Minister is saying he hopes that cash can begin flowing to Canadians by April the 6th. We know a lot of people have to pay their rent on April the 1st. So this is a matter of real urgency for a lot of people out there. Who have lost their jobs or are their small businesses are suffering because of this pandemic. This is happening all over the world, of course, including in the United States, which has become a real hotspot for the coronavirus. There are, I think yesterday, the United States had the biggest single-day increase in number of new cases. And the government there, too, trying to help Americans who are affected by this. Let's go to our Washington bureau chief, Jackson Prosco. Jackson, there's a $2 trillion package that has been approved in the United States for Americans. What can you tell us about that?
Hi, Donna. Well, Democrats, Republicans, and the White House have at least agreed on this package. They still have to pass it, but it seems like they are at least on the same page. And so what they're looking at in this country are direct payments to individuals, where they're talking $1,200 per person, $3,000 per household. They're looking at propping up struggling industries like airlines and hotels and hospitality. They're also looking at loans to hospitals and medical professionals because, remember, it's private health care down here, and some of those hospitals are saying that they are struggling to stay afloat right now given the massive costs that they face at the moment. So, Donna, all of this is coming together. It's helping the markets. They surged yesterday. They're up slightly today. This seems to be what people have been waiting for, and now it's just a matter of getting everyone to vote and sign off on it. Similar story to what's taking place in Canada in that regard.
Yeah, interesting. And, in terms of timeline, what all the medical experts are telling us in Canada, in the U.S., around the world, is that we're in this possibly for certain for weeks, possibly for months. And yet the President of the United States yesterday gave his own timeline, which shocked a lot of people. Here's what President Trump said.
I said earlier today that I hope we can do this by Easter. I think that would be a great thing for our country, and we're all working very hard to make that a reality.
So, April 12th, there are people in the United States, senior public health officials, who are saying, well, if that was possible and if he had the power to do that, he would put millions of lives at risk. Could cost millions of lives. But I guess the other thing, Jackson, is that the president doesn't actually have the authority to sort of get the country working again anyway. So much of what's happening there as here is governed by what happens at the state level.
No, you're absolutely right, Donna. And to give you an example of that, shortly after President Trump came out and said he wants everything back and up and running 18 days from now, the mayor of Washington, D.C. came out and shut down all non-essential businesses in this city where the president lives for at least 1 month. And that's what you're going to see across the country. It's a patchwork of state and local officials deciding what's best for their jurisdictions. The president cannot override that as much as he might want to. And there's simply a reality factor out there as well, where medical advisors, even those who are appearing with the president at these daily briefings, are saying, look, Mr. President, it's nice to have a goal in mind, but you have to be flexible here. You have to consider things on a day-by-day basis. New York State, which has seen 60% of the cases in this country, 25,000 confirmed cases, more than 300 deaths in New York State alone. They've said they don't expect the epidemic to peak in that state for 14 to 21 days. How could you possibly get back to normal business if that was the case?
Not possible. So, which raises the question, Jackson, why does the president say things like this? It did help the stock market yesterday, that's for sure, as did the $2 trillion coming in. The government support, not just in the United States and Canada, but around the world, these stimulus packages do seem to buoy the stock market. But is that what's motivating him?
It is to a large extent, Donna. He's a president who ran on the economy. It's an election year, and a down economy is not good for any president seeking re-election. He has tweeted multiple times and said out loud as much that the cure shouldn't be worse than the problem itself. And there are a lot of people in Trump's corner, conservative commentators, conservative media, who are all echoing the same message that the country shouldn't be shut down because of a disease, in their words, and I'm paraphrasing here, but they say, look, tens of thousands of people die from the flu or in automobile accidents, and those aren't grounds to shut down the country. And so they're acting sort of perplexed as to why a pandemic would be good enough to shut down the economy. Obviously, you talk to any healthcare expert and they say this is a dire situation. Just look at the rates of hospitalization, if not the fatality rate itself, and you can understand why the country needs to be shut down, why people need to stay home, why businesses need to close. But the president seems to be operating on his own timeline here. And in fact, Donna, he is only a little more than halfway through his own White House campaign called 15 Days to Stop the Spread. And yet here he is downplaying the risks and musing about restarting the economy.
Yeah, it's increasingly hard to actually listen to what he says. And I think a lot of people here, anyway, tend to tune him out because what he says is so, and at times, so dangerous. But Jackson, let's talk about the issue of testing in the United States. The country seemed to be far behind some other countries, including here in Canada, in getting an early handle on where the clusters of cases were. We know there were some in Washington State, in the Seattle area, and nursing homes, and they sort of were able to capture that and do a lot of contact tracing there. But in the rest of the country, in particular in New York City, things seem to have gotten completely out of hand, and tests are really limited still.
It was very, very slow to ramp up, that's for sure. In the early days, it seemed as though there simply weren't enough test kits available, for example. There was confusion over whose test kits should be used. Labs were slow to roll out testing. An example here in Washington, D.C., if you were getting tested, your sample had to be sent to North Carolina, and then it could take up to 7 days for results. They're speeding up now, and the number of test kits has been rolled out. And New York State now says it has the highest per capita rate of testing of anywhere in the world. So that's some good news, and that's why you're seeing this surge in confirmed cases. But the point is, as you point out, they were late to the party here, and I think that allowed this to grow rapidly. It has grown to the point, Donna, that health officials are now saying to Americans, if you've been to New York City recently, you need to go home and self-isolate, Donna.
I'm going to interrupt you, I'm afraid. Thank you, Jackson. Let's listen to the Prime Minister.
Figure out what needs to be paid and how to plan for the coming months. If you've been laid off, had your hours reduced, or are worried about your industry, these might be really stressful decisions. Far too many Canadians are having these tough conversations about finances and their future. Just look at the numbers. Last week, almost 1 million people applied for employment insurance. The hard truth is that people are out of work because of this crisis and worried about what comes next. So I want you to know that we'll be there to help you. Our government is doing everything we can to be there for you. Tôt ce matin, la Chambre des communes a adopté un projet de loi d'urgence pour aider les gens le plus rapidement possible. Le projet de loi est maintenant devant le Sénat. J'espère que son adoption va se faire rapidement pour qu'on puisse aider les Canadiens dès que possible. On aura plus de détails pour vous cette semaine et d'autres mesures à annoncer. Et ce n'est qu'un début. Mais cette nouvelle loi nous permet de prendre les mesures nécessaires pour vous appuyer tout de suite. On va notamment bonifier l'allocation canadienne pour enfants et reporter de 6 mois la date de remboursement des prêts et bourses étudiants. Et surtout, avec cette loi, on introduit la nouvelle prestation canadienne d'urgence. Cette allocation remplacera les 2 allocations qu'on a annoncées la semaine dernière, soit l'allocation de soins d'urgence et l'allocation de soutien d'urgence, pour simplifier le processus. Comme je l'ai dit depuis le début, à mesure que la situation évolue, on s'ajuste pour mieux vous aider. La prestation canadienne d'urgence donne 2 000 $ tous les mois pour les prochains 4 mois aux travailleurs qui sont privés de leur chèque de paye à cause de la COVID-19. Donc, si vous avez perdu votre emploi, que vous travaillez à temps plein ou à contrat, ou que vous soyez travailleur autonome, cette prestation est là pour vous. Si vous êtes malade ou en quarantaine, ou si vous prenez soin de quelqu'un qui a la COVID-19, cette prestation est là pour vous. Si vous devez rester à la maison sans toucher de salaire pour prendre soin de vos enfants ou de vos aînés, cette prestation est là pour vous. Et même si vous avez encore un emploi, mais que vous ne recevez pas de rémunération à cause de cette crise, la nouvelle prestation canadienne d'urgence est là pour vous. Un portail en ligne pour soumettre les demandes sera lancé le plus rapidement possible. Et les gens commenceront à recevoir de l'argent dans les 10 jours après avoir présenté leur demande. The Canada Emergency Response Benefit will provide $2,000 a month for the next 4 months for workers who lose their income as a result of COVID-19. This will replace the 2 benefits we announced last week, the Emergency Care Benefit and the Emergency Support Benefit, in order to streamline the process. Like I said from the start, we will adapt our approach wherever needed. If you've lost your job because of COVID-19, whether you're full-time, contract, or self-employed, this new benefit will be there for you. If you're sick or quarantined, looking after someone sick, or at home taking care of your kids, it's there for you. And even if you're still employed but not receiving income because of this crisis, the CERB is there for you. An application portal will launch as quickly as possible, and people should start receiving money within 10 days of applying. I know people are concerned about delays. Families are worried about when they'll get help. It can be hard to get through on the line, and that is frustrating. Public servants are working around the clock while dealing with unprecedented demand and all of the same personal stress everyone else is facing. They will get to your application. Help is on the way. In order to speed things up, we're rapidly deploying workers from different departments to deal with claims. In the last 10 days, we've boosted the team by close to 13,000 people to take your calls, process your claims, and get you the support you need. And since last Monday, we've already processed 143,000 employment insurance claims. That means more money will go directly to people right across the country. We're working to get you the support you need when you need it. And if you're doing okay, there's a way you can help someone else, as an employer, a landlord, or even just a friend, so you can be part of the solution. It can make all the difference, because it's by working together that we'll get through this. And our team knows that. We're collaborating with the provinces and territories, as well as with First Nations, Inuit, and Métis Nation communities to coordinate our efforts and ensure that everyone is supported. Earlier this week, with the premiers, we also discussed testing for COVID-19. We know that how long you wait for your results varies widely. The premiers and I know we need to address that, and we are. This is something Minister Hajdu and I discuss with officials every day, and we'll continue doing what's needed to speed up results for everyone. But I also want to recognize the incredible work medical professionals are doing on this front. According to Dr. Tam, we're now testing about 10,000 people a day. That's a huge increase in numbers in a very short period of time. And it's because people across the country are working tirelessly to make it happen. At the same time, we're helping companies, labs, and scientific institutions produce and supply what we need most, from masks and ventilators to vaccines and antiviral drugs. We're collaborating with airlines to get Canadians home from abroad and instructing everyone that they must isolate at home for 14 days. We're also working with our international partners on this crisis. This morning, I had calls with President Sall of Senegal and President Kagame of Rwanda to share strategies on keeping people safe and addressing the economic impacts of this pandemic. I've also spoken to Prime Minister Abiy of Ethiopia and President Kenyatta of Kenya about international coordination. And tomorrow, I'll be speaking with other G20 leaders to discuss further global coordination to our response. Plus que jamais,
more than ever, it is absolutely essential for Canadians to have access to the last information, most recent information, and but media also bear the consequences of the situation and the virus. So in order for us to help journalists to carry out even more essential work during a crisis, our government has announced supporting measures for the media. Secretary Guilbeault will provide more details later on. But I want in the meantime to thank all the media who provide information and keep Canadians abreast of developments, facts and reliable info. We are grateful to you for your work.
Right now, it's more important than ever that Canadians have access to the latest news and information. To ensure that journalists can continue to do this vital work, our government is announcing new measures to support them. Minister Guilbeault will have more to say about this shortly, but I want to take a moment to thank our journalists and media for everything they do, today and every day. Above all, the most important way we can work together is by staying apart. Social distancing is our best tool to stop people from getting sick. I know people are seeing different graphs about how effective social distancing can be and new maps tracking the spread of this virus. Every time you turn on the TV or go online, you probably read something new. I know I do. And you'll want to know what's coming next. Today, I'll be getting the latest modeling from the Public Health Agency of Canada. And we'll discuss how to share this information even more directly with all of you. But you deserve the best information we've got about what's happening today and what tomorrow might bring. Because otherwise, the uncertainty can be really tough, not just for your routine, but for your mental health, too. We're facing a once-in-a-generation challenge, and on top of that, you can't do many of the things that keep you feeling good, getting together with friends or having dinner with your neighbor. If you need help, reach out to your neighbor, to a sibling, to a friend, to a hotline. But do it from home. Don't go out unless you absolutely have to. If you're already following these rules, thank you for doing your part. If you aren't, know that you're making a dangerous choice. Because ignoring these rules puts every single one of us, yourself included, at risk. Voici la réalité.
This is the reality. If people refuse to follow the directives, our doctors, our nurses will be more exposed to contracting COVID-19. And if our health professionals become sick, then they can't go to work, so they cannot cure and treat you if you become sick. Our country is confronted with the most important and the most serious public health crisis of its history. People who keep receiving friends for dinner and who keep socializing put everybody at risk. Our storekeepers, food stores, and even the people who look at look at the beans, the garbage bins. So if you have to go out, keep a distance of 2 meters from each person, and people, if you fly back from international flights, go back straight home and stay home for at least 14 days. And this has to be applied to everybody. If we want to go through this crisis, we all should be supporting one another, and we should all do our part. And I know that Canadians are able to up to the challenge. Thank you very much.
Bonjour, Monsieur Trudeau, Louis Blouin de Radio-Canada. Je vous demanderais plus de
Louis
clarté
Blouin,
sur
Radio-Canada.
si possible.
Do you have any more clarity on timetables? April 6th is what Mr.
Morneau
is giving us a date for deploying the new benefit.
Va arriver le 6 avril,
That's when it comes into force. So what exactly is going to happen? Will there be an online platform? People will be receiving no help then before mid-April. What will you say to people who need help right now? We are working in, this is an unprecedented situation. We know how much pressure there is to help people as quickly as possible, but we also recognize that a very large number of people need to be helped within a very short time, and we need to establish quick but reliable systems to achieve that. That is what the government is working on, and we are, in fact, hoping to have the system in place online for April 6th, with money flowing in the days, in the very few days thereafter. We hope to be taking applications even before April 6th, but that's the date we're working towards. As for people who need help, we are well aware that there are many in difficulty now. People who stopped working almost 2 weeks ago will not be getting their usual paychecks, so we're doing everything we can by providing better access to credit and other measures. We are listening, we are doing everything we can to be there, but we will all have to work together to get through this.
This is an unprecedented situation with an overwhelming amount of demand by Canadians to get money as quickly as possible. We need to make sure we're getting that money out quickly, but also reliably to Canadians, and that means doing things that government hasn't done before and scaling up our processes extremely quickly. We need to do that in a way that is going to be both reliable and quick, and that's why we're pulling together people from across government to get this done. We are hopeful that the system will be up and running by the 6th of April, and that checks or the direct deposits will be flowing days after that. We recognize that that is a ways off still, and there are people who stopped working a week and a half ago, 2 weeks ago, that are now receiving their last paycheck and not knowing when the next money is kind of coming in. We recognize that. We're looking for ways to help people bridge through credit or other measures their ability to make it to the arrival of the Canada Emergency Response Benefit, but we will continue to work diligently and rapidly to make sure we're helping every Canadian we can.
Prime Minister Marika Walsh with the Globe and Mail. 60 business groups are calling on Canada to launch a wage subsidy that's in line with the UK and Denmark. So 70 to 80%, they say it would be much more efficient than the slow process that you're rolling out right now. You've been asked about this for several days now. Your question keeps being, things are still on the table, but people are laying off workers now. Now you seem to be saying that struggling businesses could choose to simply not pay their employees rather than laying them off, and the workers could then receive payments under this new benefit. Is that what you are urging struggling businesses to do, and why not go with the higher wage subsidy?
We are absolutely looking at more direct help for businesses. We recognize that in an ideal situation, businesses wouldn't have to lay off people, and people wouldn't have to feel like they've lost their job and don't have a job to come back to after this crisis. So we are working with business groups. We are working with small businesses, hearing their concerns, looking very carefully at the models put forward in other parts of the world, like Denmark and Germany and others, and looking at how we can make that work or make equivalent things work here in Canada. We will have more to say on that in the coming days. Okay. Nous reconnaissons que dans une situation idéale, les gens.
We recognize that ideally people would not lose their jobs because of what's happening, and that employers should not have to let people go. This is something we're trying to deal with them. We know that there are some models working in Germany and Denmark. We are providing help more directly through the Canadian Emergency Benefit, but we will also be providing direct assistance to small businesses. There'll be more on that in the coming days.
Oliver with CTV National News. I know you just talked about more direct support for businesses, but can you be more specific in the meantime? You said it will come out later this week. There are many businesses that have already laid off people. There are people at home who cannot afford to pay their rent, and those checks are due very soon. What specific aid is available right now for people who are sitting at home who cannot afford any of their bills?
Well, for businesses, we moved very quickly to make credit available for them, to help them bridge through this time, to help them get the liquidity they need at a time of crisis and significant slowdown in the economy. For people at home, we recognize that loosening up rules around credit is also a possibility. We've taken certain measures on that. We know people are anxious. We know that their final paychecks from 2 weeks ago, from last week, are starting to come in now, and they don't know where the next one is going to come in or when the next one is come in. That's why the Canada Emergency Response Benefit is going to flow as a way of giving them $2,000 every month for the next 4 months so that we can get through this together.
Bonjour, Raymond Fillon de TVA. Monsieur le Premier ministre, vous en êtes
Raymond Fillon,
maintenant
TVA. Prime Minister, this is your 14th day of self-isolation. Does that mean you can emerge from it tomorrow? And is your wife still having symptoms? Thank you for your questions. Sophie's feeling much, much better, and the children and I still have no symptoms. We will continue making sure we follow all recommendations by health authorities. That means that every day we are following the recommendations. If things change, we will let you know.
Good morning, Prime Minister. Janet Silver, Global News. With more than 1 million Canadians returning from overseas, especially in hotspots like Europe and New York City, why are we relying on the honor system and not using the Quarantine Act to isolate them, given we know that some people have boarded flights with symptoms just so desperate to get home?
It is extremely important that everyone returning to Canada isolate themselves for 14 days. This is a measure that will both keep them safe and prevent further spread of coronavirus through Canada. This is something that we require of every single Canadian coming to this country. We will continue to tell people that. We will continue to highlight that. We will continue to require that of anyone coming into Canada, that they isolate at home for 14 days in order to protect everyone in the country.
How can you require it if it's not mandatory?
It is required for people to stay at home for 14 days.
But it's not mandatory.
Olivia Stefanovic, CBC News. Prime Minister, we've learned that sick Canadian travelers are masking COVID-19 symptoms to get through airport screening. Why does Canada not test temperatures, screen air passengers for fever, or use thermal screening at airports? Should there be thermal screening and consequences for those who mask their symptoms?
We recognize that there are many concerns about passengers returning to Canada, which is why we're asking people to immediately isolate as soon as they get home. It is a requirement. We also know that there are different countries using various technologies, and we will continue to look at what is the best way to keep Canadians safe. There have been a lot of discussion around thermal screening and taking temperatures and spot checks. One of the lessons learned from SARS is that it is simply not as effective as the way people would like it to be, and it can sometimes give a false sense of assurance. This is what the best medical advice and best science advice we are getting is, but we are always open to hearing stronger or different science that says, or different recommendations that say it's worth, but we will make sure that what we choose to do, how we choose to deploy our resources are in the right way to actually help Canadians and actually arrest the spread of this virus.
But Prime Minister, should there be testing, and should passengers who are returning to Canada, should there be consequences for those who mask their symptoms? And should these passengers also be forced to sign a document to make sure they self-isolate? How can you ensure that?
We know that people need to isolate when they land in Canada. They agree to an attestation in their processing when they arrive that they will self-isolate for 14 days. That is an important thing. And Canadians with symptoms will not be allowed to board flights coming home. That is a difficult measure, I know, for many people, for many families, but we need to make sure we're doing everything we can to keep Canadians safe.
But some passengers are masking their symptoms. What are the consequences for that?
We will continue to do what is necessary and have been explaining to people what it is they need to do in order to keep themselves safe and keep Canadians safe.
On va maintenant passer aux journalistes sur la ligne. Modératrice, c'est à vous.
Moderator.
Merci. Thank you. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, s'il vous plaît, appuyez sur étoile 1 maintenant.
Please press star 1 if you have a question.
Lavon Savance from Radio-Canada International. Please go ahead. Votre ligne est ouverte.
Canada, when you came to power, you announced that Canada is back. The United Nations is asking for $2 billion in emergency funding for COVID-19. Is your government prepared to join this fund? And is Canada setting aside equipment to send to countries that are very hard hit and cannot buy this equipment on the markets?
In our $1 billion COVID-19 response announced last week, we had already set aside money for international efforts. We, of course, will work with the UN, continue to work with international partners on financial support to ensure that we can respond to this global pandemic with global resources. Canada will be there to participate. And I can also highlight on your second question that we are ramping up production of necessary equipment, of emergency medical equipment, of medications. We know that there is a potential need for much more in Canada, but there is certainly a need for much more around the world. And Canada will be part of the solution, not just to make sure that Canada has all the equipment and supplies needed for our citizens, so should the situation get worse, but we will have, hopefully, equipment and supplies to share with the vulnerable parts of the world that will desperately need help.
Merci. Prochaine question.
Next question.
Thank you. Merci. The next question is from François Carabin, Journal Métro. Please go ahead.
François Carabin, Journal Métro. Please go ahead.
Bonjour, Monsieur Trudeau. François Carabin.
Mr. Trudeau, this is François Carabin from Metro in Montreal. Yesterday, the government of Quebec said that there would be a few more weeks until there would be enough masks and swabs to look after people. But on the ground, the figures seem to be a little different. And many people fear that there is simply not enough equipment. Can you guarantee that provinces will have the equipment they need to look after all patients? Thank you for the question. This is something that we have discussed at length, that we talked about at length during my conversation with the First Ministers. We know that needs are different across the country and at different times. We will do everything we can to ensure that every site has the equipment it needs to meet the immediate needs. We do have equipment across Canada that we can try to share, but we have to continue with our current efforts to increase the volume of equipment and essential products in stock. That is what we are doing. More coordination among provinces and jurisdictions will be needed to make sure that we meet the needs of Canadians, regardless of where in the country they may be. Thank you. Last question.
Merci. The next question is from Justin Ling from Freelance. Please go ahead. Your line is now open. Votre ligne est ouverte.
Hi there, Prime Minister. Last week I asked you about the possibility of reducing the prison population to help combat a potential spread of COVID-19. Since then, I've heard from prisoners, inmates, and guards who have said that prisons are not ready, that their release is not being contemplated, that there's not enough soap, that sanitary conditions are even worse, and that guards are being allowed into the prisons even after returning from abroad. What, if anything, are you going to do to continue reducing the risk in Canada's federal institutions, and is releasing inmates, nonviolent offenders, on the table?
We recognize that the incarcerated population is at greater risk of contracting and spreading COVID-19. That is why we are working closely with Corrections Canada to ensure that we're looking at a broad range of measures to keep both those who work in our correctional facilities, but also those who are residents there, to make sure that we're doing things that will keep them safe. I have said multiple times we are not taking anything off the table in terms of options in order to keep Canadians safe, and we will continue our discussions with Corrections Canada to look at options and to look at ways that we're going to keep people safe right across the country, wherever they be.
Je vous remercie beaucoup. C'est qu'est-ce qui mettra fin à la conférence de presse.
Thank you. That is the end of today's press conference. Thank you.
Thank you. Merci.
Well, again, Peter Van
All
Dusen.
right, so they're the Prime Minister wrapping up another briefing. This time, some real substantive stuff for Canadians. A lot of these briefings, he's almost acts like a cheerleader for the country. This today, given that this emergency aid package has passed in Parliament early this morning, he announced some concrete details, things that Canadians can expect in the coming days. Specifically $2,000 a month, which will be paid for the next 4 months. This would go to people who lose their jobs as a result of COVID-19. These are full-time, contract, or self-employed people. It would go to people who are sick or quarantined at home because they're looking after someone who is sick, or they're looking after their kids. Now, the Prime Minister did say that people should start receiving it within 10 days of applying. But the question of when the money will actually start flowing gets a little more complicated because it's a process that has to take place in order to roll out this money. And we know that millions of people are likely to apply for it. Let's go to Mercedes Stevenson, who has been watching all this. Mercedes, what struck you about what the Prime Minister said today?
Well, Donna, the part that I actually found really interesting was the pressure he was under about Canadians returning to Canada who are coming home and they're telling people to self-isolate after being out of the country. It's what I'm doing right now after being in the United States. But a lot of people aren't, and there's no way to enforce it. So on the one hand, you have him being very strident in saying, you must do this. But today reporters were challenging him and pushing back after days of him saying this, saying, but what is the consequence if you don't? How are you enforcing it? There's news that people are crossing the border and they're hiding their symptoms to come home because they want to get back into the Canadian healthcare system. I'm getting emails from viewers, Donna, from people who are saying, look, I was on a domestic flight, but there was people transferring onto it from an international flight. How do I know that they didn't have COVID-19 and now they're on the plane? And there have been cases of that happening. I've heard from snowbirds who are driving across the border and say, we're supposed to go straight home, but we have to drive for a couple of days to get to where we're from. So there's still a lot of questions around how exactly what sounds very simple when you say come home and stay home is in fact a little bit more complicated when you start looking at the logistics of how big our country is and how people come home. And ultimately, what the consequence is for people who don't listen. How long will the federal government continue to ask people without using something like the Quarantine Act to actually enforce people staying home? He's saying, when you come into the country, you sign a declaration saying you agree to stay home. I mean, that's the same kind of declaration you're signing as when you come home saying that you don't have more alcohol or tobacco. How do you enforce that? It's far less enforceable than a customs officer being able to open your suitcase and tell if your declaration is in fact factual. So I think the government is starting to face some real challenges on questions about it is one thing to tell people what they should do and to say that very sternly, but it is another for there to be consequences for those people or any way of tracking where they actually go and what happens once they're back in the country.
Yeah, for sure. I mean, I think the government was in a bind because they had all these people around the world who, first of all, they were told, come home now. A lot of people did come home when that warning was issued or that sort of edict was issued. A lot of people didn't, and they waited, and now they're stranded and they want to come home, and the government is working very hard to repatriate them, and as are airlines and air crews putting themselves at risk on these planes, loaded up with people coming from a lot of countries where there are a lot of cases, such as Spain, for example. So a lot of people putting themselves at risk to get Canadians home. And then I sort of asking the question, well, what happens when these people get home? And I guess my question, what I asked the health minister on Monday was, what about the Quarantine Act? And if we can quarantine the people who came from cruise ships when this first all started, should we not be using some stronger measures to quarantine people who are now coming from overseas? It's a question that I think maybe it's too complicated to do that now. Maybe the resources don't exist. I'm not sure what the holdup is, but I think you're right. There's going to be a lot more pressure to try to figure that out. I want to get back to the issue of helping Canadians financially. Mercedes, the Prime Minister did say that they're rapidly deploying people from a number of departments to put them into one in order to process all these claims that they're expecting to get. He said 13,000 people. I think he misspoke. It's actually 1,300 people, but nevertheless, a lot of bureaucrats, government workers are being deployed to try to process these requests. That's going to be an overwhelming situation, I think. There'll be a lot of people looking for this $2,000 a month because we're approaching April 1st, and a lot of people, of course, have to pay their rent on April 1st. A lot of people have to pay their bills throughout the course of the month, and many people who will have lost their jobs are living on their last paycheck right now. So how much, how complicated is this rollout going to be for the government?
Well, we've never seen anything like it. So it's going to be pretty remarkable. I mean, we've set a record with the number of Canadians applying for this, and there'll be more. It's not going to slow down because there's a number of small and medium-sized businesses that are struggling through right now. I'm hearing from business owners. I'm hearing from people who work for those businesses, Donna, and they're making it through and they'd really like to continue. But the reality is financially, they may not be able to continue to pay people's salaries. And people know that, who are working for the companies and who are running those companies and are very worried about what happens. So the bell curve on this is just going to increase as the COVID-19 crisis goes on, and people aren't able to pay that unless there's some sort of additional significant support for small and medium-sized businesses to try to offset that. Bigger companies are in a better position. They're able to keep people on, but they have to beef up the number of people who can process those applications, because as anybody who's ever applied for a government benefit knows, it can take some time. It can be complicated. There can be red tape. It's not always hard. It's just that the machinery of government doesn't always move quickly. So they're trying to get around that. No doubt there will be some initial hiccups whenever you bring a bunch of people together like that. But what they need to find is a way to process that stuff very quickly, and also process that in a way that they can do remotely too, because you don't want to put all of those people in one location together looking at things. I was speaking to somebody who's a friend of mine who works for the federal government. They were telling me that they don't even work around this department. And I was hearing this late yesterday, but they were getting a call to come in. It was sort of all hands on deck. They're working remotely from home, but to find anybody who knows anything about processing these kind of benefits that could jump on that and provide help to make sure that these are processed as quickly as possible, that people are getting their checks, that they're not in a bind waiting for that money from the government.
Yeah, just the IT systems alone, you think, must be incredibly complex. Mercedes, he was also asked about why not go with wage subsidies for businesses, something that countries like the UK and Denmark, and I think Germany too, have chosen to go that route, so that businesses don't have to lay off their people. They may not be coming into work anymore, but they're still getting paid, and the governments are subsidizing those wages so that when this is all over, the people can just come back to work. He said maybe that's on the table at some point in the future, but that's not the direction they've gone. They've gone for the direct money in your pocket approach.
Yeah, exactly. So, I mean, on the one hand, the direct money in the pocket approach means that people get the money as quickly as possible when they're in need. But the downside, and you'll hear this from a lot of the small and medium-sized business owners, is they want their business to continue after this, but they simply don't have the means to go on in perpetuity. A lot beyond even a month or two are in serious trouble and looking at laying people off. They'd rather not. They'd rather not go through the chaos of having to stand the company back up again, rehire everybody, onboard them again. And that's why countries like Denmark and the UK have opted to allow companies to basically put the funds through them and keep those workers on board. Now, what's happening here is that you'll get the money, but you might no longer have a job. And so one of the questions he was asked was whether that's a sensible approach. If it means that people have to be laid off in order to get money, is that motivating the wrong kind of behavior? Do you want to be able to make sure they get money but still keep their jobs and there's business continuity after the crisis? So I think that's going to continue to be a question for the Prime Minister. I know it's something a lot of the business community would like to see. Whether or not they go in that direction is a question. So far, as you say, Donna, they haven't done that. But particularly as I think you start to see small and medium-sized businesses falter going forward, there'll be increased pressure for that kind of wage subsidy.
All right, Mercedes Stevenson, thank you from your home in self-isolation there. I appreciate it. Let's go back to Mike LeCouture. Mike, you've been speaking to some people about the screening process at airports that's not as stringent as a lot of people would like.
Yeah, I mean, I've been speaking to passengers, friends who are coming home and saying that they're not really being asked much. Have you been to Italy, China, Iran, that type of thing? Have you been to the U.S.? But I have had conversations with people who are saying that inside cabinet, this has been a debate. What do we do? Do we have people screening at airports like we've seen across the world in different countries? And here is the decision that they are facing, and the concern is that if we take frontline healthcare workers, who are the people who have to be taking all these temperatures, and put them in airports, then they're not in hospitals and clinics. And is that a problem? And that, I think, is why this government is hesitant to go that route. And even though, as we heard today, the Prime Minister was questioned many times that, people are getting on planes and not being honest about it. The Prime Minister said, look, during SARS, we saw the temperature screening was not effective as we had hoped it would be. And I think there's even evidence in this current crisis that it wasn't as effective. Consider this. Members or people who were on the Grand Princess, passengers who were picked up in Oakland, California, there were a number of them who were screened. You weren't allowed to get onto that government chartered plane to come to CFB Trenton if you'd not been screened. A number of those people were screened, temperatures taken, they were fine, they got on the plane, they get to CFB Trenton in Ontario, boom, they have symptoms. that is a concern as well for people inside cabinet right now. They worry that there are false negatives that could be provided along the way. So that's why the Prime Minister, as you said, has gone from cheerleader and I think, now sort of turning more towards disappointed dad. And I don't know if it's partly because he's been in the house with his 3 kids for this long, or he's frankly just getting to this point and saying, look, folks, either we're going to impose some sort of a curfew or send you to your room if you don't do what we say. But clearly his tone is changing on this, and it has, on people self-quarantining, self-isolating. So that is the consideration that is going on with this government right now. Is the best thing to do to put people at airports and to screen people, because then they're not on the front lines in hospitals and clinics, and do we need them there before we need them at the airports? Because I think the government is hoping they can just rely on people's goodwill, but right now it doesn't seem like it's working, Donna.
Super quick question, Mike. The Prime Minister was asked about prisons, too. We know in other countries, in the United States in particular, there are now prisoners in Rikers Island in New York, for example, who are positive that cleaning staff no longer want to deal with their cells. They're having trouble getting people to go to work there. And there are plans being made to release nonviolent prisoners. What was the Prime Minister's answer about that?
Yeah, and basically saying that he is very concerned about it as well, because they know that that, again, is a population that is in close proximity, saying that he's looking at that. They're very concerned about that as well. But it's unclear if he really has any answers to provide at this point. It would seem that this government and the Prime Minister is sort of looking at what they have in front of them right now in the public health. But he did say, look, we are concerned about this as well, and we're working on it. I think that this government has a number of plates spinning and balls up in the air right now, and I'm not for a moment saying that the prisons are not one of the more important ones, but at this point, it's not getting a lot of attention. So he will have to answer that question more succinctly and better in the days to come, Donna.
Lots more to come on this. Mike Lecouture, thank you. Mercedes as well. Quick recap. The Prime Minister has now, through the Canadian Emergency Support Benefit, introduced $2,000 a month for the next 4 months for people who have lost their jobs as a result of COVID-19. We'll have complete coverage of all of this on Global National later tonight, and as always on globalnational.ca. Thank you so much for watching, and we will return you to our regular programming. Thanks.
This has been a special report from Global News.
Un rappel urgent aux
An
Canadiens et
urgent
Canadiennes.
reminder to Canadians.
Vous devez pratiquer la
You must
distanciation
practice
physique.
physical
Restez
distancing.
à la maison.
Stay at home.
Limitez ou éliminez
Limit
tout
or
contact
eliminate
avec des
all
personnes
contact
à risque
with
élevé.
people who are at high
Gardez
risk.
une distance
Keep
de 2 mètres
a
d'autres.
distance of 2 meters
As
from others.
people are no doubt aware, Parliament last night passed the COVID-19 response plan. I'd like to thank all members of the House for that work. I'm glad that we got there. Today, we will hear from Canada's Deputy Chief Public Health Officer, Dr. New, from the Minister of Indigenous Services, Mark Miller, du Ministre du Patrimoine canadien,
Minister
Stephen
of Canadian
Guilbeault,
Heritage,
du notre
Stephen
Ministre des
Guilbeault,
Finances,
our
Bill Morneau.
Minister of Finance, Bill
And
Morneau.
then also with me to answer your questions are the Chief Medical Officer of Health at Indigenous Services Canada, Dr. Tom Wong, our Minister of Employment, Minister Carla Qualtrough, and of course, le Président du Conseil du
And
Trésor
the
et le
President of the
Vice-Président du
Treasury Board
Comité
and
sur le
Vice
COVID-19,
President of the
Jean-Yves
COVID-19
Dr. New.
Chair.
Good day. Bonjour. Globally, there are over 420,000 cases of COVID-19 affecting every country around the world. In Canada, as of this moment, there are 3,197 cases of COVID-19 and 27 deaths. We have now tested over 142,000 people in Canada, which is more than 20,000 additional people tested since yesterday. In the early part of the outbreak, most of our cases were linked to travel outside of Canada. While more cases now are community acquired than are travel related, we still need to do all that we can to reduce the impact of travel imported cases. For all of those already in self-isolation, we know this has been difficult, and we are grateful for the sacrifice you are making to keep others safe. Si vous n'avez pas de symptômes,
If you
vous
don't
pouvez
have any
sortir faire une
symptoms,
marche,
you
pour
can go
autant
outside for
que
a
vous
walk,
restiez au tout
as
temps à au
long
moins
as you
2
at all
mètres
times stay at
de
least 2
distance des
meters
autres. Comme
from
toujours,
others.
évitez de
As
toucher des
always,
surfaces communes
don't
comme les
touch
rampes et les poignées de porte
common
et
surfaces
lavez vos
such
mains
as
soigneusement
door handles and
avant de
wash your
quitter
hands
votre
carefully
domicile et dès
after
que
you
vous
leave
êtes de
home and as
retour
soon
à
as you're
l'intérieur
back at home.
de ce dernier. Pour ceux qui développent des
For
symptômes,
those who do
peu
develop
importe
symptoms,
leur gravité, ils doivent rester
regardless of
en
how
tout temps
serious
à
they are,
l'intérieur
you
de leur
must stay at
domicile.
home
Des
at all
outils en ligne
times.
vous aideront
Online
à
tools
déterminer
will
si vous
help
avez
you to
besoin
determine if you
d'une
need
évaluation plus approfondie ou d'une analyse de détection
greater
de la
evaluation or
COVID-19.
whether you need a
Jetez un
COVID-19
coup d'œil
test.
à celui affiché
Please
à
look
l'adresse
at what is
canada.ca.
at canada.ca.
If you're not experiencing any symptoms, it's okay to go outside for a walk, as long as you maintain at least 2 meters distance from others at all times. But as always, avoid touching common surfaces like handrails and doorknobs, and wash your hands thoroughly before you leave your home and as soon as you're back inside. But for those who do develop symptoms, no matter how mild they may be, you must remember to remain inside your house at all times. There are online tools that will help determine whether you may need further assessment or testing for COVID-19. Check out the one on canada.ca. Right now is an extremely critical time for all of us to get it right. We need to get this done. Let's plank the curve. Thank you. Merci.
Okay, thank you very much, Dr. New. Now we will hear from our Minister of Indigenous Services, Mark Miller. Mark, please.
Kwe Tanse, Ulukut, good afternoon, bonjour, Sego. First Nations, Inuit, and Métis are among the most vulnerable groups in Canada. And during this crisis, in particular, those in remote and fly-in-only parts of this country are uniquely vulnerable. And I want to reiterate that my sole priority, one that is shared by the Government of Canada, is the health and safety of Indigenous peoples in Canada. Nous reconnaissons que la situation de la COVID-19 au Canada évolue de façon rapide.
Situation in Canada is
That is
evolving
why,
rapidly.
as part of the COVID-19 economic response plan announced by the Prime Minister last week, our government is providing $305 million through the Indigenous Community Support Fund directly to First Nations, Inuit, and Métis leadership to provide them with the maximum flexibility possible to do what they need to support their communities in a time of crisis. The allocation of funds reflects discussions we've had with First Nations, Inuit, and Métis partners in each province and territory about their unique and specific priorities during this pandemic. These funds will flow directly to Indigenous communities with maximum flexibility to help adapt responses to address local needs. We will do this quickly and with a sense of urgency that this situation obviously necessitates. I want to stress that this is only one of the financial measures that we are contemplating for First Nations, Inuit, and Métis. Cela pourra se traduire par un soutien aux aînés, des mesures visant à lutter contre l'insécurité alimentaire, de l'aide à l'éducation pour les enfants et les jeunes, une aide financière pour les personnes sans emploi, une assistance en matière de santé mentale, ou encore l'activation des services d'intervention d'urgence. Et ce n'est qu'un début. As for the distribution of funds, the First Nations portion of this is $215 million. Each First Nation will get a base amount adjusted for population, remoteness, and community well-being. The Inuit portion is $45 million and will flow to each of the 4 Inuit land claim organizations through an allocation determined by ITK and regional leadership. For Métis, there will be an amount of $30 million, which will flow through each governing member. The remaining percentage, which accounts for $15 million, will go to supporting regional, urban, and Indigenous organizations supporting those who live away from their communities. Ce fonds s'ajoute au financement déjà annoncé qui sera basé sur les besoins des communautés et permet de répondre rapidement aux questions de santé publique, par exemple en fournissant les équipements de protection individuelle et de tests et des programmes de planification d'urgence. We've seen a lot of measures taken by communities to protect their populations, from closing their borders to declaring local states of emergency. I want to recognize their important work and the strength that they have shown. But let me be clear, this is just the beginning. We know that more support will be needed, and we will be there to make sure no Indigenous community is left behind. Our government is here to support you during this time. Miigwech, merci, nakumik, thank you, merci, nyawangoa.
Okay, thank you very much, Mark. Now we will hear from le ministre du Patrimoine du Canada,
Minister of Canadian
Stephen
Heritage,
Guilbeault.
Mr. Stephen Guilbeault. The floor is yours. Thank you.
Bonjour à toutes et à tous. Je pense qu'on peut prendre un moment pour se rappeler à quel point la pandémie actuelle nous montre à quel point il faut être solidaire et prendre soin les uns des autres. La situation est infiniment complexe et elle évolue à vitesse grand V et tous les secteurs touchés doivent être pris en compte. La radiodiffusion et le journalisme, des secteurs essentiels en temps normal, mais encore plus en temps de crise, sont mis à dure épreuve en raison de la baisse soudaine et importante de leurs revenus publicitaires. In order to get through this crisis, it is crucial that Canadians can obtain authoritative, well-sourced, and factual information related to COVID-19. This is why the Government of Canada is taking immediate action so Canadians can continue to access diverse and reliable sources of news. Tout d'abord, il me fait plaisir d'annoncer, au nom de ma collègue Diane Boutillier, ministre du Revenu national, que le comité consultatif indépendant qui travaillera avec l'Agence du revenu du Canada sur la mise en œuvre des mesures fiscales qui avaient été annoncées dans le budget 2019 est maintenant formé. De plus, je confirme que la vaste majorité des 30 millions de dollars investis par notre gouvernement dans une campagne nationale de sensibilisation sur le COVID-19 seront investis dans les médias canadiens. Que ce soit à la télévision, à la radio, dans les journaux et magazines ou encore en ligne. Afin que les revenus générés par cette campagne puissent offrir un peu d'air frais à nos médias, j'ai l'assurance de mes collègues ministres de la Santé et des Travaux publics travaillant sur ce dossier qu'ils seront payés rapidement. Speaking of national information campaigns, I want to mention the initiative of the Canadian Medical Association, the Royal College of Physicians and Surgeons, and the College of Family Physicians of Canada, coordinated by the Canadian Public Health Association and supported by Volunteer Work and Advertising Agency. Together, they are preparing a public health campaign and partnering up with Canadian media and online platform to air it. This is a reminder of how Canadians can pull together to help each other. Finally, because immediate access to liquidities is critical for many editors and publishers, the Department of Canadian Heritage is putting in place a simplified application process for the Canadian Book Fund and the Canadian Periodical Fund. This means that beneficiaries of these programs will be receiving their 2020-2021 funding within the next few weeks as opposed to the next few months. We take these measures to ensure that all Canadians can receive factual information related to COVID-19 and to support our media and cultural organizations. Thank you. Merci.
Okay. Merci, Stephen.
Thank you, Stephen.
And now we will hear from our Finance Minister. Bill, please.
Thanks, Chrystia. Thank you. First of all, let me say thank you to all of the parties that worked together last night to get unanimous consent on our legislation, allowing us to move forward with the measures we know we need to move forward with to support Canadians during an extraordinary time. As you've heard me say, extraordinary challenges necessitate extraordinary measures. And that is indeed how we've gotten to where we are with the benefits that we are putting forward to support Canadians, the benefits that we're putting forward to support businesses, and the benefits that we're putting forward to support our economy. So I'd like to walk through with where we are right now. We have realized over the last week that the very best way that we can support Canadians who are out of work, who are sick, who are in a situation where they're supporting an elderly parent, who are in a situation where they're at home because they're protecting themselves and their families, is by having one emergency benefit. So in the legislation we move forward with, it's one emergency benefit, the Canada Emergency Response Benefit. And the idea is that we are going to deliver for every Canadian that finds themselves in a situation where they've earned revenue in the past 12 months of $5,000 or more, and they don't have any income as a result of COVID-19, they can get this benefit. It's $2,000 per month for 4 months. So what we're doing is ensuring that we enable people to bridge through this very difficult time so they have the resources they need for themselves and their families. We've designed this in a way so that it's a wage subsidy delivered directly to employees, to people. So what this means is that for an employer, they will not have to separate the employment of their employee from their organization. So in that way, we're directly supporting employers. They will just be in a situation where if this employee is no longer receiving income from their company, they can in fact be guaranteed that this employee will be able to apply in a simple way and get access to $2,000 per month for 4 months. That is, we think, critically important. What we've done over the course of the last week is to make sure that these benefits can be delivered in a simple and efficient way, getting money into people's pockets as rapidly as possible. We're working hard to make sure that administration is able to be done. We're targeting the week of April 6th for us to be able to deliver on this for people. That's important. There's more work to be done to ensure people that we can deal with the very large volumes, and that work is being done by my colleague, Carla Qualtrough, my colleague, Diane Laboutier, right now as we think about how we can best deliver on that. What this means for our overall economy. The impact of what we're doing for the economy is very significant. The approach we've decided to take means that we are entirely funding this through the federal government. And that means that the estimates in terms of the kind of economic support that we're giving are significantly different than they were last week. So rather than the expectation of direct support to Canadians and to small businesses of $27 billion, we are expecting right now that direct support be budgeted at $52 billion. So that is a significant change because of the scale and the significance for people of these benefits. So when you look at what we've done, that's $52 billion in direct support expected. And on top of that, there's $55 billion in tax deferrals that we've said are there because neither individuals nor corporations will be forced to pay their income tax before August 31st. So a total package of $107 billion into our economy. I spent some time yesterday on the phone with G7 finance ministers. The day before, I spent some time on the phone with G20 finance ministers. And what I can tell you is Canada is taking a very, I would say, appropriate, but also significant approach to responding to the incredible challenge that we're facing today. Je voudrais dire que c'est très important pour nous d'avoir une situation où les gens, n'importe la situation,
people, regardless of their situation,
dans une position sans revenu,
if they don't have income over the next 4 months, for them to be able to have $2,000 a month for 4 months. That means it's a direct wage subsidy to people and will also help companies. That's very important
Donc, on va continuer de considérer comment nous pouvons améliorer la situation pour les petites et moyennes entreprises.
Shift the situation for small and medium-sized enterprises, but right now, with these measures, it's important to see that we have assistance for people, a total of $52 billion in direct support,
avec la situation
and
avec les impôts
with the tax deferrals for individuals and companies, they can take up to August 31st to pay their taxes, and this will inject another $55 billion in revenue into our economy. It's a total of $107 billion.
Pour considérer comment nous pouvons
we can look at how we can be aggressive to deal with this situation today.
Donc, merci beaucoup et
Thank
je
you
suis
very
bien
much.
sûr à l'aise pour répondre
I'm happy to answer your questions.
Okay, thank you very much, Bill and all colleagues, and we are indeed ready to answer your questions.
Okay, as agreed, we'll start with 3 questions on the phone, and then we'll get back to the room. So, operator.
Certainly, thank you. Merci. Please press *1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while participants register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. The first question, la première question, is from Chrystia Freeland from Globe and Mail. Chrystia Freeland de Globe and Mail. Please go ahead. Your line is open. À vous la parole. La ligne est ouverte.
Good afternoon. Thank you for doing this again today. I understand that the health minister just told the upper chamber that as of midnight tonight, that powers in the Quarantine Act are going to be used to ensure that travelers other than essential workers are going to be subject to a mandatory 14-day isolation. My question is to the Deputy Prime Minister. Can you just speak to why the government is now taking the specific step to ensure that this self-isolation for travelers is indeed mandatory? And are you planning an enforcement tool to go along with this? Because how are you going to police people?
Thank you very much for the question. And let me just reiterate that, yes, the health minister will be using powers that she has under the Quarantine Act beginning at midnight tonight to impose a mandatory 14-day period of isolation on all people coming into Canada from outside Canada. This issue was discussed at length at the Coronavirus Cabinet Committee on Monday. All Canadians have been working very, very hard to practice physical distancing in their lives, and we have for some time now been urgently advising people coming into Canada to self-isolate for 14 days upon their return. We have decided that now is the time to make that measure mandatory. I think we all really appreciate that it is so important to have this self-isolation to protect the health and safety of Canadians. And I may turn to Dr. New to offer some, would you like to offer a public health perspective?
Yeah, certainly from a public health perspective, we've been repeating many times that it's important in terms of physical distancing so that individuals don't expose each other potentially to the virus, and also the public health principle of the 14 days being the outer limit for an incubation period. And so respecting those public health principles, the minister has also said repeatedly, travelers coming back to Canada, you might have been exposed because everywhere in the world there's COVID-19. So when you come back home, it's important to protect your fellow Canadians by self-isolating for 14 days. So this is just an appropriate step, certainly from a public health perspective.
And I will just add, we had the Prime Minister led a call with the premiers of the provinces and territories earlier this week. We have seen the provinces stepping up and taking more clear measures within provinces and territories, including some provinces and territories imposing restrictions on travel from outside the province and territory. I think all Canadians understand that this is a serious situation It will get worse before it gets better. As a country, we are lucky to have an outstanding national healthcare system and terrific healthcare professionals, but we all need to do what we can, as we heard from Dr. New at the beginning of this, to flatten the curve and indeed to plank the curve. And this mandatory isolation will help all of us do that.
Thank you. And just as a follow-up, I was wondering, for the finance minister, we understand that your department has been talking to banks about possibly using them to distribute money to businesses specifically. I'm wondering if the minister can please provide a specific update on how these talks are going.
Thank you. The banking system is a source of strength for Canada. We have, I believe, the strongest banking system in the world. It enables us to work together with the banking system to make sure that we can actually provide the kind of credit that businesses need, businesses of all sizes. We're working together and have been working literally overnight over the recent days to make sure that we have not only the support that we outlined last week, the Business Credit Availability Program, the backstop of the Business Development Bank of Canada and Export Development Corporation, for small business and medium-sized business loans, but also the capacity for the banks to deliver on all sides of businesses the kind of credit they're going to need to get through a challenging time. I would say that those discussions are going very well. The banks are working well together with us, but we don't have anything final to report in terms of exactly the parameters of how we're going to move forward. And when I do have those final parameters, I'll be coming to be transparent as rapidly as possible.
Thank you. Operator, next question, please.
Thank you. The next question is from Lena Dibb from Canadian Press. La prochaine question de Lena Dibb de Presse Canadienne. Please go ahead. Your line is open. À vous la parole. Votre ligne est ouverte.
Merci. Monsieur Morneau, j'ai une question à propos de votre nouvelle prestation. Le problème souligné par tout le monde, c'est la vitesse de distribution de l'argent. Et je comprends bien, cet argent-là n'arrivera pas avant 3 semaines au moins. Alors, faites quoi pour que l'argent arrive plus rapidement aux Canadiens que vous réclamez tout le monde?
Merci. C'est une question très importante. Pendant les dernières journées et semaines, nous avons travaillé ensemble pour assurer que nous pouvons avoir une approche simple, efficace et très vite pour délivrer l'argent aux Canadiens qui est nécessaire dans notre situation aujourd'hui. Donc, nous avons trouvé quelques systèmes dans le gouvernement fédéral qui peuvent nous aider d'avoir une approche très efficace et très vite. Ça va prendre quelques jours. Je suis certain que nous devons assurer que les systèmes fonctionnent bien. Et je sais que c'est nécessaire de le faire aussitôt que possible. C'est exactement ce que nous voulons faire. Aujourd'hui, nous pensons que la semaine de le 6 avril est la semaine quand nous allons avoir la possibilité de délivrer pour les Canadiens et les Canadiennes. Mais chaque journée, si on a des nouvelles, nous allons expliquer notre situation. C'est très important et nous sommes absolument dans une situation où c'est la tâche la plus importante chaque journée pour moi, pour Carla Qualtrough, pour Diane Goutier, avec les systèmes qui sont très importants.
Je comprends vos efforts, mais sauf que ça n'arrivera quand même pas plus vite. Ça n'arrivera quand même pas avant 3 autres semaines si on ajoute les 10 jours dont M. Trudeau parlait à votre date du 6 avril. Et ça, c'est à condition que tout le système qui démarre le 6 avril sur un portail puisse fonctionner et n'explose pas. En fait, si vous voulez commenter ça, puis mon autre question à propos de cette quarantaine que la ministre Haidou impose et à propos de la frontière plus en général, étant donné ce qui se passe aux États-Unis, vous allez faire quoi pour imposer cette quarantaine? Je peux comprendre que maintenant on ordonne, on ne fait pas juste suggérer, mais est-ce que vous avez les moyens de vérifier les entrées des gens et de les suivre pendant ces 14 jours? Vous allez faire ça comment?
Merci pour la question.
Thank you for your question.
Concernant la quarantaine, c'est un changement Maintenant, c'est une quarantaine obligatoire. Et évidemment, on aura les mécanismes pour enforcer la quarantaine. C'est pour tous les voyageurs d'étrangers, incluant les voyageurs des États-Unis, sauf que les travailleurs qui font du travail essentiel. Et je veux aussi souligner, je veux souligner que notre conseil n'a pas changé. Pour quelques jours, on a conseillé très fermement pour tous les voyageurs d'étrangers de s'isoler après la rentrée au Canada. Le changement, c'est que jusqu'à minuit, aujourd'hui, la quarantaine deviendra obligatoire. Je m'excuse.
Mais quel mécanisme? Vous dites qu'on aura des mécanismes. Quel mécanisme?
Une question en suivi, s'il te plaît, par équité pour les collègues. Operator, next question, please.
Thank you, merci. The next question is from Althea Raj from HuffPost Canada. Prochaine question d'Althea Raj de HuffPost Canada. Please go ahead. Your line is open.
This wasn't going to be my question, but since you didn't answer it, what enforcement mechanisms are you going to use to ensure people are staying home and abiding by this quarantine?
It will, from midnight tonight, be a legal obligation of people entering Canada from outside Canada to self-isolate for 14 days. I do want to emphasize essential workers are excluded, as has been the case with the strong advice from the Prime Minister, from public health officials for some days. In terms of the specific penalties and enforcement mechanisms, we will be giving you more information later today.
Okay, thank you. And my question is actually for Bill Morneau. I want to talk about the bill, yesterday's bill. I'd like to know what made you think that it would be a good idea to ask Parliament for the powers to tax and spend without their approval until the end of 2021, not even this year, but next year. What made you think that was an appropriate response to this crisis?
Well, thank you for the question. And I think what I should start with saying is that I'm pleased that we got last night, actually at 6 a.m. this morning, to unanimous consent with the other parties to move forward on our response plan for Canadians. We know that this is an extremely challenging time for people, and we need to respond appropriately. The bill that we got to, that was worked through the system, is one that will allow us to have the abilities that we think we need. What I can say is that last week, you heard me say to Canadians that we will do whatever it takes to support them and to support our economy through this challenging time. And what you're seeing is that as we move forward, we will do that. We will think about how we can have the ability to move quickly, to respond to challenges, events that are in many cases completely unforeseen. What we see not only in Canada but around the world is that the issues that we're facing one week are different, significantly different in many cases than the issues we saw the week before. Canadians expect us to be prepared to deal with these challenges, to have the ability to move quickly, to have the funding so that whether we need to buy personal protective gear on a moment's notice because we can find it, or whether we need to support a province that's in an extreme challenge because of their situation, that we have the capacity to do that. So we are seeking to make sure that we have the ability to do that. We know that sometimes these authorities will be required at an unprecedented speed. You're hearing Chrystia talk today about the need for us to get back to you with details this afternoon on important measures. We are working in order to make sure that we have the capacity to protect Canadians, to get ourselves through this, and to come out of this challenge. This is, we expect, a very challenging time, but a temporary time, to come out of this challenge with our economy intact. We unfortunately do not know either the depth nor the duration of this challenge, and that's why we are keen to be working together with other parties to make sure we continue to have that capacity to respond in a very, very timely way to every challenge that we see.
On va prendre 3 questions dans la salle avant de retourner au téléphone.
Questions in the room before we go back to the phones.
Julie Van Dusen with CBC. Ms. Freeland, Donald Trump, American president, is looking towards Easter, which is April 12th. He wants American workers back at work then. Can Canadians expect to be back at work around the same time?
Thank you for the question, Julie. Our approach in Canada is to act very much in accordance with science and with the advice of our excellent public health officials. Many Canadians are at work today providing essential services, and I know that all of us are really, really grateful to those Canadians. As for Canadians who are doing non-essential work or able to work from home, we need to continue to maintain these practices of physical distancing to be sure that we can flatten the curve, or in the term that Dr. New and Dr. Tam have been using, plank the curve. And I know that we all appreciate, and certainly after the debate in Parliament last night, we appreciate it even more. Physical distancing does come at an economic cost. Our government has taken, you've heard more about it now, very significant measures to support Canadians through this time. But what I would like to say to Canadians, and I think the whole country gets this, is it is better for the health and safety of Canadians, and in the medium term, it is better for our economy to practice physical distancing now, to flatten the curve, and to be able to get out of this. In terms of specific timelines, I think what we need to do and what we are doing is follow the science and see how the situation is developing, and that's what we're going to do. And maybe Dr. New wants to add something.
Certainly, if you look at the science and the evidence and also the experience of other countries around the world with the COVID-19 pandemic, I can say that it's not days and weeks, but certainly months that this pandemic will endure. So certainly from a public health perspective, we're not thinking it's going to be over in the next few days or so.
Ahead with his plan and turns a blind eye to the impact of the virus. What is your plan to step up screening at the border for everyone crossing it, including essential workers?
Well, I think we announced today some stepped up border measures, which are very important ones, the mandatory quarantine. And I do want to say about those border measures, I trust Canadians so much. Canadians are great, and people have been making real personal sacrifices to self-isolate and to practice physical distancing. At the same time, I think all of us are going to be and feel safer with mandatory quarantine for anyone entering Canada. In terms of essential workers, we need to be really thoughtful about what we do there. And let me give you the example of truckers, something that we have discussed in government and with business and with labor leaders extensively. We rely on cross-border trade for essential goods like the food in our grocery stores, for essential medical supplies. And those goods arrive very often by truck. So we need to be thoughtful about how the people who provide those essential services, including facilitating cross-border trade, are treated. And that is why Minister Hajdu today very specifically said that the mandatory quarantine will not apply to essential workers. We, of course, understand that the situation in the world and on our continent is fluid and evolving. And as the situation evolves, we are constantly, and by constantly I mean every single hour, reviewing additional measures, including measures at the border.
Thank you, Dylan.
Doctor, I'll start with Minister Miller. We're hearing about a capacity shift to the south, that doctors are returning from reserves to urban communities, that there's an encouragement of telehealth. Is that shift happening? Are there doctors coming from abroad to fill that? And how does that fit in with the pledge for equitable health services for Indigenous Canadians?
Thank you, Dylan, and thank you for the excellent reporting you're doing on Indigenous issues in particular. There's a number of realities that Indigenous communities face that include shortages of nurses, shortages of doctors, and as part of the discussions we're having with Indigenous communities, Inuit, Métis, and First Nations, looking at what that capacity gap is and how to fill it in the most expeditious manner is part of that conversation. And so this is an ongoing discussion that is happening in real time. I'll defer to Tom to answer a lot of those direct questions. But as we identify the needs both for surge capacity, which will allow us to deploy quickly into region should the epidemic hit in a fashion that we need to act and support rapidly, or getting out that basic public message, that comes with a lot of discussions over financial resources, which I talked to about you today, but also physical resources, personal protection equipments, capacity of to get doctors and nurses on site in a rapid fashion in a way that will best serve those communities. I'll let Tom answer the rest of the question.
Thank you very much, for your question. We are working with the network of physicians and nurses and other health professionals in order for them to be part of the surge capacity should a community needs that. Thank you.
A question for Dr. New. We have provinces that are shifting to satellite labs away from their central labs. Is everything still being confirmed at the National Microbiology Lab? What is the service standard for returning results to provinces? And what is the current backlog of the samples to be tested at NML?
Okay, so in terms of the testing regime, at the beginning of the situation in January, certainly all of the laboratory confirmations were done by our National Microbiology Laboratory. But certainly several weeks in, what happened is that obviously good collaboration between our laboratory and the ones in the provinces and territories. And now we have several provinces that have what we call a validated assay. So there's no need to have that sort of test or reconfirmed at the NML. If one of the provincial labs in British Columbia, for example, Alberta, Ontario, Quebec, validates it, has their own test result as being positive, that's confirmed. It doesn't have to go to the NML. At this point, the NML is there to help some of the smaller provinces that may not have that capacity. And certainly in terms of a turnaround time at the NML, once they get the sample, it takes less than a day.
Okay, one last for the room before going back to the phone. Kelsey Johnson, Reuters.
Thank you for taking my question. My first question is for Dr. New. It's our understanding that C-13 allows the government to, quote, make, construct, use, and sell a patented invention to the extent necessary to respond to the public health emergency. I'm wondering, does this apply to drugs, and could it lead to compulsory licensing for COVID treatments, existing or new, including vaccines?
Okay, that's out of my scope in terms of my expertise. I certainly, as a public health physician, we work closely with our colleagues at Health Canada. But if you're looking at licensing regulations and so on, I certainly I'm not in a position to be able to answer that. We do know, obviously, our Minister of Health, Minister Haidu, has approved in terms of some of the new testing technologies. So I can speak to the sort of the posture we're putting forward in terms of our laboratory testing approach across the country, but in terms of specific licensing and regulations, I can't speak to that.
Worth a shot. My follow-up is for Minister Morneau. You have said that there is going to be additional aid and additional measures coming. I'm wondering, can you know when we will see that aid and what areas it's going to be in, as well as when are we going to see the energy package?
We have been working to make sure that we deal with the most urgent and important issues first. And what, from our perspective, we've realized is that there will be Canadians, many Canadians, who find themselves without income, perhaps already and certainly in the coming days. And that's why we've put that at the very first thing on our agenda. Pretty much simultaneously, we've said we need to support businesses so that they can bridge this time from where we are today to when we get through this issue. So that has meant that we need to work on multiple fronts at the same time. We need to make sure that we have adequate financial capability for firms to make that time possible. And so that's why we're working with the banks to make sure that credit is available to businesses, small and large. And it means that we need to be thinking about not only the scale of the companies, but also the particular sectors. You mentioned the oil and gas sector, the energy sector. It is one of the sectors that's particularly hard hit because they have the issue both around the COVID-19 challenge and around the low price of oil and gas as a result of the OPEC decisions. So we know that that's at or near the front of the things that we need to be concerned with because those small and medium-sized enterprises in that sector are particularly vulnerable. But I want to just make sure that people understand it's multiple sectors. We're looking at the airline sector. We're looking at the hospitality sector writ large, which is facing enormous challenges, making sure that we can deliver from them. In terms of when we'll have more to say, it will be in the very near term. In the coming days, what we want to do is give people a more full understanding of how the impacts will be mitigated to the best extent possible in this challenging time. Today, I think what you've heard us say is not only are we ensuring that people have access to $2,000 a month for 4 months, but that is something that is directly advantaging companies because the companies don't need to separate their employee from their company. They just need to say, we can't pay you during this time period. And when that happens, there's a direct wage subsidy to people, to employees, so that they can actually live their lives. When this is done, they can go back to work for their employers, and that we think is critically important.
Merci. Opérateur, on va prendre 3 questions.
We're going to take 3 questions, one in French to start.
Thank you, merci. The next question is from Manon Cornelier from Le Devoir. La prochaine question de Manon Cornelier de Le Devoir. À vous la parole, votre ligne est ouverte.
Merci.
Thank you.
Monsieur Morneau,
Mr. Morneau,
j'aimerais comprendre parce que votre première annonce d'aide date déjà d'une semaine. On nous dit que le 6 avril pour mettre un portail en ligne, donc 10 jours de plus, ce qui fait qu'on est rendu à 17. Et M. Trudeau dit qu'il faudra 10 jours pour avoir un chèque. Donc on est rendu à 27. Bref, il y a près d'1 million de personnes qui ont demandé l'assurance emploi la semaine dernière, donc c'est sans compter tous ceux qui n'ont pas droit. Les gens qui ont besoin urgent de cet argent-là.
Really need this money urgently, and you're telling them 27 days from the time of your first announcement and when the check arrives. Is that reasonable given the current situation? How can you justify such a delay?
Merci pour la question.
Thank you for your question.
Je suis absolument d'accord. La situation est urgente.
That this situation is
C'est pour ça
urgent.
que nous devons trouver une façon simple,
we found a
efficace
simple and efficient
pour
way
administrer
to
notre aide. Ça,
deliver our
c'est ce que
aid.
nous proposons.
And that's what we're
On va
proposing.
avoir un système
We're
qui
going
va
to have a
délivrer
system
aux gens
that will be delivered to
argent
people,
dans les prochaines 2 semaines.
delivering
Nous
money in the
pensons
coming
que
weeks.
ça va
We
commencer
think
le
it will
semaine
start
de
in
6
the
avril.
week of
Je ne
April
peux pas
6th.
être exact
I
au
can't
niveau
tell
de
you
date parce que nous
an
sommes en
exact
train
date
d'assurer que nos
because
systèmes
we're ensuring
fonctionnent.
that our
C'est
system
clair que
will be
nos
working.
systèmes n'étaient pas
Clearly, our systems
avec une capacité de considérer
didn't
le
have the
niveau de
capacity
défi en ce moment.
to
C'est pour ça que nous
rise to
trouvons
this
une
challenge, and that's
façon.
why we're finding a way
C'est
now
urgent, c'est important.
to deal with
Et
this.
nous
It's
serons
urgent,
là.
it's important,
Ça va
and we're going to be there.
encore quelques
It
jours,
will
je
take
sais, et
another
je
few
sais que
days.
c'est
I
difficile pour
know
les gens.
it's
Ça,
hard
c'est
for people.
absolument le cas. Mais nous devons
And
le
that's
faire
absolutely true,
et
but
nous
we
devons
have to
avoir
do
une
this.
approche
We have
qui
to have
fonctionne.
an approach that works.
Sinon, on va avoir une
Otherwise,
situation plus grave.
the situation
Donc,
will be even worse.
Pendant les prochaines journées,
In the
nous
coming
allons avoir
days,
plus à
we're
dire
going to have more
exactement
details.
comment,
We'll be able to tell you exactly how
et
and when.
c'est certain que nous
And of
devons
course,
travailler
we
ensemble
do have to
pour
work
assurer
together
que nous pouvons
to
avoir
ensure
une bonne approche
that
pour les gens.
we do have a good approach.
Ma question, là, elle est très précise. Je ne sais pas si quelqu'un a la réponse. Si vous ne l'avez pas, dites juste que vous ne l'avez pas et épargnez-moi le spin parce qu'il y en a beaucoup et c'est un peu fatigant. Le travail sur ce système de distribution efficace, rapide et simple de l'argent aux Canadiens a commencé quand? Le travail technique pour que ce soit possible. Parce qu'on a attendu l'annonce la semaine dernière, on a attendu l'adoption du projet de loi, on a commencé quand à élaborer le système
On a commencé pendant les dernières 2 semaines d'avoir une approche qui fonctionne. Ça, c'était déjà commencé. Donc, ce que nous sommes en train d'essayer maintenant est d'assurer qu'avec le niveau de demande, qu'on a la capacité d'assurer les gens que l'argent va être là pour eux. C'est très important. Donc, nous allons avoir plus à dire.
We're going to have more to say about this.
Le travail était commencé il y a plus d'une semaine.
Was started more than a week ago.
Nous allons utiliser les systèmes les plus efficaces
the most efficient system in the federal government to ensure that the funds are there.
La raison que nous avons décidé
cette semaine d'avoir this week to have a single benefit in place for all Canadians in a situation where they're lacking income because of COVID-19 is because clearly we do have to have a system
assez efficace,
that is
assez
efficient
fort pour
and strong enough to make sure that we'll be there for them. And I think we found a good solution, and we're going to continue to work to ensure that the system will function as it should.
Thank you. Operator, next question, please.
Thank you. The next question, la prochaine question, is from Alex Bellinger from Toronto Star. Please go ahead. Your line is open. À vous la parole.
Just on the next steps, I guess, of the financial aid targeted at certain sectors, does the bill that we expect to be passed by the Senate today, this new bill, give the government the power to enact that spending, to send out the next steps of money for this without recalling Parliament, without passing another bill?
I think that question was for me.
Yes.
Yes.
I do too.
So what's clear is we need to have the capacity in the government to act rapidly. We also need to think about the challenge that we're facing. We know that getting the opportunity for credit to businesses, small, medium, and large, is critically important. We know that in order to do that, we need to have the authorities to make sure that Business Development Bank of Canada, Export Development Corporation, both have the ability to deliver. That goes as well for Farm Credit Canada. So the bill, as it's being looked at right now by the Senate, enables us to lift those limits so that we can deliver that sort of financial credit appropriately considered to all those organizations. And the Parliament has approved this morning, as you know, at 6 o'clock, that bill that does allow us that capacity. That's why we're working together with the banks to get to a conclusion on how that can best assure that we get it out in a rapid way to businesses facing challenges.
And just as a follow-up, I think this might be for the Deputy Prime Minister on the enforced mandatory quarantines. We know that a lot of people return from spring break. We've seen repatriation flights in recent days. Will this apply retroactively to people who've come back to Canada recently? I guess will it apply retroactively?
No, the mandatory isolation applies at midnight tonight for all travelers into Canada. And just let me remind people that already when people say fly into Canada, already at those kiosks we're familiar with, you get a screen which strongly recommends that you self-isolate for 14 days, and you have to acknowledge that you have received that strong recommendation. So that is already in place. People are already clearly being advised to do this, and they need to acknowledge that they're advised to do this. We will, from midnight tonight, be taking the contact details of all returning, of all people coming into Canada, and then we will follow up with them to be sure that they are indeed self-isolating, because as of midnight, that becomes mandatory. But let me emphasize, you should be doing it already. This is a step we can all take to protect the health and safety of Canadians, and ultimately to ensure that our economic rebound comes more quickly. If we can flatten the curve, then we can go back to normal life more quickly.
Okay, thank you. One last question on the phone, and then we'll take one from the room and call it a day.
Thank you. Merci. The next question is from Micheline Lafemme. Prochaine question. Micheline Lafemme de Radio-Canada. Please go ahead. Your line is open. À vous la parole.
Merci. Monsieur le ministre Duclos, on voit que la contamination s'aggrave aux États-Unis. Il y a des foyers importants qui sont même très, très près de chez nous. Alors, j'aimerais savoir jusqu'à quel point ça vous préoccupe et qu'est-ce que vous envisagez pour resserrer la circulation des marchandises et des personnes. Est-ce que vous l'envisagez en ce moment?
What are you planning right now?
Merci. Alors, je pense qu'il est important de toujours se souvenir que nous avons la chance d'être au Canada lorsqu'on vit une telle crise en raison rapidement du système de santé extraordinaire que nous avons par rapport à d'autres pays et aussi en raison de la capacité du gouvernement central d'agir rapidement pour assurer non seulement la santé et la sécurité des Canadiens, mais aussi la sécurité économique. Évidemment, on est tous conscients que nous avons une très grande frontière avec les Américains, qu'au sud de la frontière, les conditions sont différentes et que nous devons faire tout ce qu'il faut et nous allons faire tout ce qu'il faut au cours des prochains jours et des prochaines semaines pour non seulement garantir ce mouvement de biens absolument essentiels, mais s'assurer que ce mouvement de biens essentiels s'effectue dans un contexte où la santé et la sécurité des Canadiens est garantie. Alors, les mesures que nous avons annoncées encore aujourd'hui au sujet de la quarantaine obligatoire des voyageurs, de tous les voyageurs qui rentrent au Canada, même s'ils rentrent de la frontière américaine, cette quarantaine est maintenant obligatoire par la loi à partir de minuit ce soir. C'est une autre mesure qui renforce notre capacité de nous protéger des défis et peut-être même des menaces qui existent ailleurs dans le monde, et en particulier au sud de la frontière.
Notably south of the border.
Est-ce que c'est une possibilité? Est-ce que éventuellement vous pourriez considérer de restreindre le trafic encore plus pour justement éviter que cette contamination-là augmente chez nous?
Toutes les options sont ouvertes parce que nous devons considérer toutes les éventualités, toujours à nouveau dans un souci de nous assurer qu'on a les biens essentiels au Canada, les médicaments, les équipements médicaux, la nourriture dont les gens ont besoin pour vivre et parfois même pour survivre au Canada, mais tout en gardant évidemment un œil toujours plus attentif sur ce qui se passe au sud de la frontière.
Merci.
Thank you.
Go back to the room for one last question. Mike from Global. You're good? Okay, maybe one last question on the phone then, operator?
Certainly. The next question is from Lauren Gardner from Politico. Prochaine question de Lauren Gardner de Politico. Please go ahead, your line is open. À vous la parole.
Thanks for taking my question. Both the Prime Minister and Minister Duclos have indicated this week that restrictions at the Canada-U.S. border could be tightened even further, depending on how the number of cases plays out in the states. And Minister Duclos, I believe, also specifically mentioned workers in that. Could you describe what it would take, what the threshold might be for the government to further tighten what's already happening at the border? And what do the contingency plans that the Prime Minister mentioned yesterday on the border look like?
Well, I think we've seen today some of the contingency plans that the Prime Minister was referring to coming into force. Obligatory quarantine of everyone coming into Canada is a serious further step. It's an important step, and it should make all Canadians feel much safer. We took last week very careful and very significant measures when it comes to our border with the United States, measures that we took very much in collaboration and cooperation with our American neighbors, and measures that were carefully designed to ensure that essential work, essential trade can continue. You've heard us all today really emphasizing the extent to which the food on our tables, the drugs in our drugstores really depend on that cross-border trade. And I do want to take a minute to thank the truckers who are driving back and forth across the border every day. They are doing important work which we need to actually survive. We are, of course, thinking very carefully about additional measures. You've seen us already in the course of just the past 10 days take a real series of steps to improve control at the border, including the obligatory quarantine. That is something we are constantly reviewing, and we will continue to review it. I also do want to say that cross-border traffic has been decreasing very significantly. So we have been seeing people responding both to these border restrictions and also to the broader message, which people are hearing from their governments in both Canada and the United States, and frankly around the world. And that message is that now is a time to stay home. Now is a time to practice physical distancing. And that is what we are seeing on our continent, at our border, and around the world.
And as a follow, Minister Freeland, I'm wondering if you could reflect on what it's been like to make these sorts of calls that you were just describing over the last 10 days, understanding we're in uncharted territory and it's a global pandemic, but given that this government has a history of projecting that it's open to people coming from different places, what has it been like to make these calls that are a total 180 of that in some respects?
I don't think they are at odds with our government's core beliefs or my core beliefs in any way. Our government totally understands that our absolute priority needs to be the health and safety of Canadians. In pursuit of that, the federal government, provincial governments, municipal leaders, Indigenous leaders, Canadians across the country have been doing extraordinary things. Our children are not in school. Very, very many people are working from home. Many people are not working at all. We are practicing, all of us, social distancing. I hope all of us are practicing it in ways that have had a huge impact on all of our lives. These are extraordinary times, and I know that we all get that. And those extraordinary changes absolutely need to have an impact and have had an impact on what we're doing at our borders. This is not any kind of shift in our government's views. This is about taking very practical steps to protect the health and safety of Canadians. The 14-day quarantine is very much another step on that path, and we will always put the health and safety of Canadians first. And I think all of us feel very clear and very confident that that is the right direction.
OK, merci beaucoup. C'est ce qui clôt la conférence de presse pour aujourd'hui.
Thank you very much. That wraps up our press conference for today.